everyone. This is the December 12th, 2025 meeting of the Commission on the Environmental and Public Health Impacts of Per and Polyfluorinated Alkylated Substances. I'm Chris Bandazian chairing the meeting. We have a quorum, so I'm calling the meeting to order at 2:04 p.m. We did not have a quorum in November, but we do have notes of the meeting that Amy kindly took, and so we'll have a vote on approval. I'll note absences, but is anyone in opposition to the minutes as prepared or have any comments on them? And if not, I'll take a vote. All those in favor say aye. Raise hands. Any opposed? No. Okay, and I will tabulate who the abstentions are based on attendance last meeting. Commission membership update. Glad to know that Ray Brislin is a signature away now from becoming official, and he joins us here today with Ron Dunn. So that's great progress, and we'll proceed directly to the DES update from Mike Wimsatt.
Okay, good afternoon, everyone. So I'm trying to focus on things that have changed since or been updated since last time, so I won't go through everything. No changes with respect to Air Resources Division or the facility closure. It's the same as I reported last month. With respect to POET system installations, as of December 3rd, we have 791 POET systems that have been installed. That's point of entry treatment systems for those who aren't familiar with that term. And of those, you know, given the requirements for confirming that those are working properly, a total of 754 of those out of the 791 have been considered officially complete because they've completed their testing regimen. Moving on to the sampling of wells and such, the recent term sheets, for the recent term sheets between 23 and 27, which are the updates to the sampling requirements and the sampling plans, approximately, or excuse me, not sampling, but water line connections and such. 17 properties with proposed municipal water connections. Our St. Cobain is proceeding with water line work for those properties at present. As far as the working with the water utility, Pennachuck, and the town of Londonderry to evaluate the feasibility of water line extensions in that community. We continue to work very closely with them and with St. Cobain to get that finalized. I believe we are quite close. I don't have anything specific to report now, but I think there will be an agreement that will pave the way for that work to proceed. And that, of course, is a large number of water line connections that would occur west of High Range Road. So we'll hopefully have something to talk about soon on that. As far as proposals for remedying additional water supply wells elsewhere, we have term sheets that go through attachments that go through attachment 28. So that keeps getting updated. That was received in November. And that includes an updated list of remedies for all the properties since the April 2022 proposal. And we anticipate that we will receive an additional one in January of the new year. So that continues to move on. As far as water supply sampling goes, as we've discussed previously, the groundwater management zone work plan includes getting a lot more data and some repetitive data on wells. So with the work plan that St. Cobain has proposed back in January of last year, that creates conditions where by the end of 2026, we should have 6 PFAS sample results for each property that's eligible for sampling within the GMC. And so that work is ongoing. And so far, St. Cobain has sampled approximately 1,520 properties that were eligible for monitoring under the revised work plan. and they anticipate continuing to sample between 100 and 200 properties per month to meet the requirements of that work plan. So again, we would anticipate that we would have 6 rounds of sampling for each well in total since the sampling has started. And that's resulted over time in about 169 additional properties. That's up 6 from last month that have been identified as exceeding the ambient groundwater quality standards for PFOA, and therefore those have been offered bottled water. As far as, we've talked previously about previously unsampled wells within the consent decree. To be clear, all the wells that we're aware of that have been, have been offered and if accepted have been sampled at this point, either by Saint-Gobain or by the agency. But we did get some movement on the part of the company to agree to sample additional wells that they had not previously been willing to sample. We had gone and sampled those, but they're willing to go back and get additional samples for those. And those are in Bedford and Litchfield. And they've started sampling in accordance with the work plan that they submitted. And each of those identified properties should be sampled twice by them before the end of 2026. As far as site investigation goes, as we've talked about, we've had a long path here on getting to a remedial action plan that we can approve. As part of the struggle for that, they developed a work plan back in the summer of this year to do identifying some additional sampling objectives to support their development of a remedial action plan. They had some issues with site access for that. Some of that is on the adjacent property owned by, the name escapes me at the moment, but the development to the south there. So they're working on that, and they anticipate very soon getting to do the additional groundwater and soil investigations on that property, Flatley property. That's the name that was escaping me. So that we hope that work will be beginning soon. And then let's see. Other updates with regard, we've talked previously about the need to get a lot more soil data within the consent decree area. And as discussed last month, we anticipate getting a revised work plan for that during the first quarter of 2026. So we'll expect to see that before the end of March of 2026. And that really is just focusing on the things that have changed since our last update. My notes will be more complete, as they always are, and there'll also be the figures and diagrams there that show the relative accomplishment of waterline connections and POET installations in each town. So there'll be those figures as well. And I'll be happy to take any questions.
Okay, thank you, Mike. Questions? Rosemary?
Oh, thank you. Can everybody hear me okay?
Yep.
Mike, I have a few questions. What about the houses, even though they're not in the consent decree, what about the homes, the properties that are east of High Range Road? If the water line's going to go down there, are those houses going to at least be offered a connection, even if Saint-Gobain doesn't cover it? Would the town be doing it? Has there been any movement on that?
Yeah, that's a great question. So the town of Londonderry actually is very active in looking at this. They are, they're looking to get that High Range Road main established, and any connections west of High Range Road would be accomplished and paid for by the company. But everything east of High Range Road, they are interested in extending water there. They did get a significant grant from the trust fund, not all of which was expended or will be expended to accomplish what's being discussed right now. So they will be likely coming to establish the available or reestablish a work plan for using those additional funds. So I think there is a lot of energy in the community and in town government to not only getting the water main installed and getting the wells west of High Range Road connected, but they're looking to expand water system availability east of High Range Road as well.
Okay. And do you know, and I don't know, maybe Ron can answer this. is the town or DES doing any sampling of those wells? Because I know within 500 feet they have to, there's a notification, or 500 yards.
Sure, we've done sampling far afield from the consent, obviously, lots
Yeah.
of places in all directions. And anybody who has requested sampling east of High Range Road has been sampled. And we continue to respond favorably to those requests. And in fact, there are some who have been tested and have been found to be above standards and have taken advantage of the rebate program to get a point of entry treatment system into their home.
Okay, and then another question, I have a couple more questions. Another one is, now the RTO was installed, I don't know, a couple of years ago, I forget. But are we doing any testing of the sampling wells on site or groundwater to see if there's any attenuation occurring yet?
There is ongoing, monitoring. We don't have a groundwater management permit yet, so it's not memorialized in a permit, but there is work being done. I think candidly, with the volume of the releases that occur there, and in fact, a lot of the, or at least a significant portion of what's in the ground on the site proper is very likely to result not only of air emissions, but of more conventional releases of PFAS products on the site. So I would not anticipate that the operation of that RTO for the short period of time after it was permitted to the time where they ceased operations, that would have had any specific, significant impact on the groundwater quality in the immediate site proper.
Okay, so we're not seeing any, it's either staying the same or getting worse from continued.
I don't know how much repetitive data we have for the wells on the site, but at some level, those wells are so contaminated that I'm not really sure that, in the absence of several years of regular monitoring, that we could draw any specific conclusions from any trends we might see.
Okay. And also, how many people, are there people still on bottled water?
Anybody who has been slated for a potential, particularly in Londonderry, being slated for a potential water line connection would still be getting bottled water while that's being resolved.
Okay, it's just Londonderry?
There may be there are probably a handful of additional homes in other towns where the final connections have not been made, but the bulk of folks still on bottled water would be in Londonderry, yes.
Okay, that's it. Thanks, Mike.
Sure.
Wendy?
Yes, thank you. I have a few questions. You talked about Saint-Gobain is continuing to do water sampling. Are they doing any soil sampling on private property at all?
Not that I'm aware of. They will likely be doing some soil sampling as part of the work that I described on the Flatley property, though I think there are a couple borings slated for that, then that would include soil sampling at the time that the borings are installed. But generally speaking, no, that's a big area where we feel like there's a lot of additional soil sampling that needs to take place within the consent decree area. And we're waiting, that's that work plan that we'll be waiting for to receive in the first quarter of 2026.
And who will eventually pay for this soil sampling?
Oh, that's a plan we're seeking for them to submit, and they would be both conducting and paying for all of that sampling.
Okay, excellent. All right, and so this is sort of related to this. I'm working with a young woman from League of Conservation Voters, and she's proposing a pilot program using mushrooms to remediate the PFAS in the soil. There have been some positive research done on this, and so we're trying to get access to Saint-Gobain land. She needs 3 4-by-4 foot plots of land, and is that something you could help us with?
I think after the last meeting, I hope you got my email. I gave you the contact information for Chris Angier, who's the Saint-Gobain representative that we deal with, and he would be the person to talk to about that.
Okay. All right, because we're hoping to go forward with that in the spring. So, and just sort of related, I've also been working with 350 New Hampshire, and their youth organization has chosen PFAS as the concept or the item of the year that they want to push. So I was at Concord High School yesterday helping them give 5 presentations on PFAS to their student classes. And they hope to make, well, they're very ambitious. They want to go to every public school. But they're well on their way, so people are doing a good job of educating others and keeping this out in the public. So thank you.
Okay. Other questions for Mike? Okay, I do not see or hear of any, so we'll move on. Update from DHHS.
Hey everyone. I don't have much in terms of updates, but I know at the last commission meeting there were some questions about the DHHS website and what kind of information we had on it around PFAS and related health effects and sort of clinician guidance. I did follow up and confirmed that part of our website was maintained by our Environmental Public Health Tracking Program, or EPHT, which is a CDC funded program, and that we don't have any staff in that program anymore because the federal funding has been uncertain. And at one point we thought there would be no grant. I believe we currently have the grant, but we don't have staff. The other thing I just wanted to note is at a federal level, I don't know a lot of the detail around it, but there was a major push to make sure that everybody's websites were accessible for everyone to be able to access information. And so the department's going to have to be undergoing a major process to redo our website so that it is fully accessible. So there may be a little bit of a period of time when web pages are archived and technically down while we're actually making them fully accessible. So that's just something to be aware of when and if you're poking around and looking for information. The only other thing I would share is that I had mentioned this on the last call. I have been pulled to be the lead on our work around rural health transformation. So I believe that we are actively looking to identify someone who will be able to continue to cover this commission moving forward, because I'll likely be pulled away from my current role as deputy. And I think that's it. Any questions, I'm happy to answer.
Questions for Whitney? Well, I will ask, is there a timeline for the website update? Is that?
Yeah, so I believe we have to be in compliance by April 2026. So we're actively making efforts to go through an update. So you may see stuff come down between now and April.
Between now and April. Okay, thank you. I want to thank you for your time on the commission. So, and good luck.
Thank you. Thanks.
Laureen, I see your hand.
I just wanted to clarify when you said that no one was working on the environmental health piece, basically, and that piece, wasn't funded. When you talk about the updates and the changes, are you incorporating, the PFAS information, or are the updates and changes in process and not including, these important information?
Yeah, so there's not really anybody right now at the department that is in a position that they would be focusing on that kind of environmental health, public-facing information. And right now we're, again, with the continuing resolution at the federal level, there's not been, and we have a hiring freeze, there has not been the ability to fill those positions that have been vacant. So I don't anticipate that there'll be work on the website because there just are not staff to actually provide that expertise. But hopefully when and if we get to a place where we have confidence in the grant funding at a federal level and the ability to do recruitment and hiring because of the hiring freeze being lifted, that we could then fill those positions.
Is there anyone?
We had a hiring. Oh,
Yeah.
Go ahead.
I know many years ago when we were first advocating for health support and community needs related to exposure, we used to hear this message that, well, we're working under DES, it's their investigation, you know, they will lead on so much of this stuff. Is there anyone at DES or any partners or academic partners that can assist in this? Because, you know, I mean, I just feel like I'm so redundant. This is the PFAS Health Commission, right? And if you look at the original charge as written and what this was all about many years ago, you know, given, you know, the largest contamination site and investigation in all of New England's history, and what's been lacking all along is the guidance and the information that people need. And, you know, we've seen in this community, many of us have worked tirelessly on our own time, in addition to work and life, to supply people with information, but we're not equipped, you know, to do that. And that's only who, you know, finds us or who we put out the visibility to and things like this. And it just boggles my mind to date that it's, you know, here we have people with frontline communities, right, who are not getting what would be expected. Even with the CDC ATSDR mission many years ago, and repeatedly on calls with them, that the public stopped attending because they just felt their blood pressure increase. And the last one we had was the part 1 of the health consultation. We never did get part 2, never, never, never. And that was promised 2.5 years ago, I believe, that it would have been completed and presented. And it was all requested in August of 2016. So their own mission on their website, while they were supposedly funded, you know, is insufficient. You know, there's this huge issue here in many, and right now federally, with, again, connecting exposure and outcome. And it doesn't take millions and billions of dollars to do these definitive causal health studies. There are ways that we can support people by working together and partnering. And we have had many residents in this community have put, I won't even say hundreds at this point. I'm looking at some of these faces and it's thousands of hours, you know, of our own time. For myself, Dawn has mentioned this to me at one point in the past, you know, if people have, you know, the luxury of having time if they're retired, that's great. But those of us who work have had losses of income, have cut back on work, and we felt compelled to step in to do something that wasn't being done and was absolutely mandatory that it has to be done. So, you know, I'm on that soapbox once again, and it's not your fault, but I think as a group here, you know, when we hear updates on 6 more homes getting bottled water, et cetera, et cetera, et cetera, month after month, well, that's great to have that information. It's way slower than I think it should be, but, you know, this is the reality of it. But the health piece, you know, in being collaborative and creative in committing to what are we going to do about this and how are we going to support people, you know, it's a disgrace, quite honestly. And again, I'm not pointing fingers at anyone here, but I think, you know, my goal is for someone somewhere to put their heads together and say, this isn't okay. What can we do, you know, for these people? We haven't touched the data. I mean, I mentioned earlier this week the University of Arizona study. I have spent every day this week, that has stayed with me 5 days, 6 days, 7 days. How many days ago did I come up with it? A week ago, I learned about it. And I was stunned. You know, Nancy Murphy and myself said many years ago in a meeting up in Concord and meetings here down in the library, and as such, you know, there's data out there that exists that we can collect and we can look at and we can assess it. And it'll give us, if anything, a signal. You know, that particular study came out of Arizona because why New Hampshire? Because we have a great map and we have so much exposure data in terms of well testing, and we've tested. So they looked at, you know, infant data that is available and is out there, and they put that together, which is what we suggested years ago. The ideal is when you have known exposure and you pinpoint it and map it out, and then you reach for what data you have and you pair them together, you're going to see something. And that will dictate what's to be done. You know, heaven forbid there's true polluter accountability, and medical monitoring, and they've done nothing, and they've been asked to do nothing, and they've been really supported quite well by the past 8 years of letting them off the hook and basically enabling them to keep exposure and outcome disconnected. But we have data that's coming out, and all I've heard from people in the state who have great credentials after the names is, well, the methods were a little atypical and unorthodox and not conventional. Of course they were, but guess what? If you look at how they did this, it makes perfect sense. It also matches exactly what Nancy and I have heard from so many people on this topic. I know we have, and it's valid. It's valid, and are we as a state going to look at that? I know the answer is going to be, well, we don't have funding. Well, we did have funding in the past, and we didn't look at it. And funding is really about, what do we want to do with our money? What do we care about as a state? And what do we prioritize? And we are not on a good course right now for the health and wellness of our citizens. And everything comes down to that. Everything is fundamental. And this research is getting a lot of attention nationwide because it is in an area of white, higher average income than research that usually gets flagged over environmental justice in frontline communities of minorities and lower income. And that from the start has been something that really astonished me, is that this isn't something that PFAS doesn't really discriminate. It's going to get you where it's going to get you, regardless of who you are in life. And again, it's invisible. It's still invisible. It's not acknowledged. And if anything, acknowledgement is going to give health guidance to prevent and to revisit and really make sure that people of childbearing years know that this is crucial, that they not have exposure at any level. That was a long speech, so I'm going to be quiet now.
Mindy?
Hi, I was going to bring that subject up of the Arizona study because I was kind of surprised it wasn't covered at all. And perhaps Whitney can go back and present on that next meeting. As members, myself and Nancy have been members for a long time of the HB 1171 Commission. Prior to that, SB 85. A few years ago, we heard from the state that the birth registry had been terminated or not being actively updated because of funding issues. So I want to raise that again right now, and maybe it's not the, well, I think this commission should worry about that as well. And so perhaps that can be brought up next legislative section for having some funding attributed to that, so that can, especially with the results of this study, so that we can continue to collect that kind of data if it's still in pause. But I was, at the time when we heard that, I think Nancy would say the same. We were kind of surprised that that wasn't a priority in the state of New Hampshire, knowing what has been going on with the state of the drinking water issues across the state. So Whitney, I don't know if you have any updated information on that registry, if that's running, if it's still paused, is there a need for legislation to fund it? And if you could next meeting perhaps be prepared to speak to that study.
I have a couple thoughts. One, I'm not aware of the birth registry being something that's, as far as I know, that lost its funding a long time ago. Like, I've been at public health for 13 years and I don't think there's been one since I've been here. I also tend to go to the legislature a lot and testify on registries, and I don't recall having legislation that was proposed around the birth registry. So that could be something worth this group thinking about. I think in terms of me coming and presenting on the journal article, I think it might be beneficial to engage the authors of the article. I don't think that I would really be able to do it justice. I don't know, I'll let Mike weigh in on their environmental health program, because I know there's like a little bit of, like a way in which the DES environmental health program might be able to like at least think about that article and help think through the methodology. And then I would say, in terms of what would be helpful moving forward to Laureen's comments, I mean, I'm struck by it's sometimes it's not even the question of what funding the state needs. I mean, that is definitely a part of it, but like who's the right partner to do what it is you all feel is needed. And I think like in my experience working with Dartmouth on the cancer cluster, the feasibility study, the phase 3, but that opened up a whole nother group of people that are really willing and able and interested in like continuing to think through how do we use data to really think, you know, to understand what the health impact is. And I think there just is that place where the health department really can only go so far because we don't do research and we don't, you know, so we wouldn't really be the right ones to take on that work. We may be the people that keep the data, and we can be helpful in sharing that and working with academic partners. But yeah, so those are my thoughts on next steps and that article. Mike, I don't know if you have any thoughts on the environmental health program and if that's something they look at.
Yeah, thanks, Whitney. Our staff in the environmental health program are, you know, obviously took a great interest in this article and they've looked at it, and I think they're still evaluating. I do think, and again, this is completely out of my ken, but I understand there's a lot of concerns about methodology and the modeling and the assumptions that were used. So I really couldn't comment it beyond that, but I think that that's something they're going to be looking at moving forward here. Try to understand, you know, what the study's really saying and whether it was really capable of making those
Right.
assertions.
Hearing that, I'll offer help if you need it, we can reach out to the authors and see if they'll be willing to come and speak to the commission.
Sure.
Generally, I find that authors and other scientists have been very receptive to coming to our commission meetings, not this one in particular, but the other that I chair. So would be happy to offer my help in that area.
Thank you, Mindy. Glad to work with you. Fine. Amy.
I think too, Mindy, when you make a request, if you could also get or prompt them to maybe to share their funding story. It looks like Proposition 301 underwrote some of the center's work, and then they applied for an NSF grant. NSF is highly competitive. And you know, not saying it can't be done, but I think it would be interesting to understand the timing of that in conjunction with what is happening under the current federal administration. Because if some of this had started prior to this administration, those funds may be, available for a long period of time and allow for a study like this. That if we know that story, then when there's a shift in administration or we understand that funding may be released from the feds, how do we piggyback on that? How do we advance their work or team with them? But I think understanding that funding story will be critical too, to understand how we can bring that to bear in New Hampshire with an eager partner, as Whitney said. You know, Dartmouth seems to be very interested and yeah, definitely already producing some results.
Rosemary, go ahead.
Good point, Amy. Whitney, I have a question. So even without a birth registry, does the state collect any birth data? Like if a child is born in the hospital, the date, the parents, the weight, is that data collected so that if there is a birth registry established, we could go back and collect that data to see if there's any trends?
Yeah, so great question. And I do know about that because there were lots of bills last session. So it's called the Live Birth Worksheet. Hospitals submit all of that data. It goes to Vital Records, and then Vital Records shares with the Department of Health and Human Services. So that's like all that kind of basic information. There may even be some detail around the health of the baby as well collected on the Live Birth Worksheet.
Okay, so we can get the data. It's just we don't have the mechanism yet to compile it and analyze it. Would you say that's what you're saying?
I think it is partly true. I am not, because as I said, I don't think we've had the birth registry for a long time. I don't know if there was additional data beyond what's collected by the Live Birth Worksheet, which I would imagine there probably was. They probably followed babies for 6 months or a year just to see if any, any health conditions were figured out post discharge from the hospital. Like hearing tests and other things that you wouldn't be able to get before discharge from the hospital.
Okay, because it seems like something like that would be an advantage not only to the work we do, the charge of this commission, but it could give some important information. I mean, even for Mindy's commission and just generally about the health of children in New Hampshire, any trends that might be impacting from birth on.
Yeah, I
Whitney?
think it would be helpful. Sorry, can you guys hear me?
Yeah, Whitney, I was just going to say, like, I know you've got a lot on your plate coming up with rural health transformation. I don't know if it's appropriate for the department or for the Institute to maybe ask if Caroline could provide some information. Caroline is the MCH epidemiologist at the state, who's, I think, technically employed by the university, but sits and is supervised by the department. I'm happy to make that ask of Caroline if she could come chat with us about the birth certificate and the data that's available, if that's of interest to the commission.
Yeah,
Great idea.
I would find it interesting.
Nancy?
Oh, thanks, Chris. Just two things I wanted to say. One was about you just raised the issue, some discussion about that live worksheet. I'd be interested to see on that. I'm guessing it probably has birth weight and that kind of stuff, but I wonder if it will have like gestational age and that kind of stuff, because that would give us some more information than just a record of birth would. The second thing I was going to say was really just speaking on behalf of citizens in the community, because we do, around town and get a lot of people reaching out to us still. And one of the concerns, and I mean, I think we talked about it a little bit, is that, we've been at this for a while. People know what we're doing. And I think there's frustration and a recognition in the community that, we say, we're concerned about public health impacts and all that stuff, and we certainly are. And I don't think people always understand all of the behind the scenes stuff and funding and all those other things and staffing. But the perspective of people looking in that we're hearing is that, is there a reason that the state may be unwilling to connect exposure to outcomes? Is the lack of funding, is the lack of staffing, is the lack of data collection, is it more than just we don't have the money or we don't have the staffing? Is it more of a concern, and rather than prioritizing public health, are we prioritizing business or polluters? And once the connection is made between exposure and outcome, then that would be the liability. And we've heard that in the past. I think we're hearing it even more so now. People are frustrated and said, okay, we know this, we've had this, the data's there. Why are we not collecting it? I mean, and the kidney cancer study was certainly a good start, but it's so much bigger than that. And I think Mindy and Laureen spoke to the frustration around, the data's here. We have the data. We just need, we need it all put together, and going forward, we need to be looking at some other health endpoints that, beyond just the kidney cancer, that I think we know we have concerns about, the thyroid disorders and all those other things. So, the reproductive things. And it's bothersome to me too, that, we have to have Arizona, right, doing this. Like, come on, we're the epicenter here. And it's like, why are we reading that, these reports from Arizona rather than from, our own state? So, it's hard to explain that to the citizens that are been living with this for a long time, and they're frustrated. And I just wanted to get that on record on behalf of the people that are living here. That come on, guys, let's do this. And what we was a bunch of us on the right side trying to do the right thing, and collectively we have to just decide what do we need to do legislatively or otherwise to get this, whether through this commission and the environmentally triggered chronic illness commission. And maybe there's a way that we work together to more closely address that and identify, next steps. So, the people will know what we're doing. And the legislature will know that, we've got 2 commissions concerned about this. And, it's the job of the people we elect to represent the people. So anyway, my 2 cents, and I just wanted to have the citizens' voices on record.
Yes.
Maureen? Go ahead.
I sent, people may have read the article. I sent a copy of the full text, 10 pages or so of the study to Chris so he could send it to everyone. So you all have a copy of the study. And just to point out that the data period that they analyzed was 2010 to 2019. That is very standard when you look at things like this because our time of discovery on record was 2016, or at least when the people knew and were informed. So just like when you looked at the explanation of the kidney cancer registry, right, when they talked about certain time periods and why they analyzed those. So if you look at 2010 to 2019, that's assuming that it was pre-exposure, a little bit after exposure, that was there all along, and the data came from that time. So I'm curious, what I don't recall, I'll have to read it again. I've read it a couple times, but where did the data, is this, if this type of data comes from the birth registry, and the birth registry hasn't been around, Whitney's saying, in the 13 years she's been around, this is 2010 to 2019. So clearly, this data is available. I would also, I can say whatever I want because I'm not speaking as a clinician or a academic or a scientist at this point. It's only my thoughts and observations. But my thoughts and observations on this, in my inkling, is given what I've learned about the collecting of cancer data, wherever they got this data is probably an under count, right? Because people move and, whatever the whole bit. And this idea about downstream, in the beginning of this, we heard that, oh, we're going to look at where prevailing winds go, and downstream, we're going to see higher numbers. In fact, when we started looking around and testing, we found numbers in all directions, right? So unfortunately, it would be my opinion that is horrific as these statistics are. They were shocking to the team to find them. What are we looking to gather here to make it more valid? We're talking about, here's exposure. We're using the dots on the map that we have. We're looking just downstream of that, and we're looking at data from that specific area. That's a pretty good pairing in terms of not needing millions of dollars, in a grant to do the gold standard science, because that clearly is never going to happen. And if you look at, lifestyle and socioeconomics and exposure history and all the other factors that, of course, we're not done because this is a look-see, they're not really going to change these numbers. They really, really aren't. The numbers are valid. It came from a data source that is on record, and it came from mapping of water contamination, and we do know where the plumes are. So, the science community is going to look at this with the gold standard scrutiny. Of course they are. That's their job. But for all of us here, it makes perfect sense, the way it was paired. It really, really does. And I think we have to start thinking outside of the box here, because there's at least 20 years of maternal infant pair studies, much work. Megan Romano has done work on this topic back from Cincinnati many years ago. And what do all these studies say in the end? Whether they are a study, a little bit longitudinal, some of them were convenience sampling, and some of them were meta-analyses, and they all say at the end, more research is needed. So, from my perspective, I am so weary of hearing more research is needed on the topic of PFAS and health impacts, where we have definitive causal links, in many aspects. We have graphics everywhere that show pictures of pregnant women and pictures of men and women with arrows to where the impacts are to health. Everything we learn matches that to a T, and yet, we're supposed to do what? Well, you guys can't prove it. It's really, really frustrating. And validation to people in this area, which we've informally provided, has gone a long way. People need to be acknowledged and seen. And this is an issue of, we should be really outraged, by this study. And it's the first that we've seen of this type. And regardless of how it was done, It's a valid study. It was peer reviewed and published. The authors are teams of researchers, do not claim causality, right? Lightly. So I think they will join us. They don't. It's their reputation. It's their work for their lifetime. So I was stunned to see that word in the interviews by them used. So we have to really kind of wake up and shake ourselves a bit and say, what are we doing here, folks? You know, what's our goal, and what's the need, and how are we going to get at some of this stuff?
Mike, go ahead.
Yeah, and I want to preface anything I say with, again, this is outside my ken, but I work very closely with some very capable professionals, and New Hampshire is blessed to have some very gifted scientists and researchers, and they're looking at this study and they're trying to figure out what it means. But just as a person and somebody who has children and has, had, a pregnant wife and all that, what troubles me a little bit about this is that an expectant mother in Merrimack who reads a story about this or the study could come away thinking that her baby is 3 times more likely to die than anywhere else. And that I'm not convinced that that is true. I don't think our experts are convinced that that's true. And to just put it out there as, yep, this is it, here's the answer, and it's much more dangerous here, that troubles me until that's really been vetted and people have had a chance to look at it and understand both what it adds to the research body, but also what its limitations are. So I'll just leave it at that, because again, I'm speaking outside of my area of expertise. I'm just speaking as a, if you will, for the purposes of this, as a layman member of this commission. That troubles me quite a bit.
You know, people haven't been really scared with all the talk we've done in town here. Somehow we've managed to discuss really tough topics, neighbor to neighbor, without really, some of the powers that be in the beginning did call myself and others fearmongers, but the public doesn't feel that we fearmongered. They feel that we're listening, compassionate, and validating. And this is a data set from 2010 to 2019. It also reminds me of that first info meeting back in 2016, where a member of the public who was in this community for quite some time, 34 years old or so, gentleman gets up and says his wife is pregnant with her first child. Should she drink the water and should he be concerned? And the advice at that time was she would be fine drinking the water because it was under 70 parts. So, in the beginning, people used to say, be careful, we don't want to scare people. I think the fear factor can be managed with, if you tune in and you're compassionate with people, nobody is looking at this in that way that I've heard of. I've heard lots of responses to this in the last week. It's been widely shared in our community. And the long and short of it is, this is a scary situation for all of us here. Everybody who lives here knows that. I know everybody in this community and other communities. It's scary. We have a phrase that we use here that says it's not a condition, it's not a question of what, it's a question of when. I see the progression of health issues in people, including my family and everyone that I know, and people who are doing all the right things, and have had all the right genetics and all the right benefits. So the fear factor that we live with, everyone knows it's there, that's tuning into this, and they're doing pretty well with that. No one has been scared away from moving to our community because we assure them that our water is filtered as close to non-detect as it has. And our community has done that to make it safe for everyone. And people are trusting in that. We also recommend the reverse osmosis because we say, if we irrigate and use extra water in the summer, maybe Penachuk water comes in. We haven't had to do that in a couple of years of drought, which is pretty good. And sometimes with media swap outs, that's how we message on that. I said, so for $200, put that in and have that peace of mind. So there's ways to be there for people without scaring them. For you to feel fear and worry about that, I get that, because we've been scared, and we've been scared without support, physician guidance, and any true backup when it comes to health. Living with that fear on our own for almost a decade, think about the impact to everyone's mental health in this area. We have to acknowledge this and really think about it in a sensible way.
Ron, I've seen fingers in your camera video. Were you raising your hand? Ron Dunn? Did you have a
I was
comment?
not. I'm sorry. Nope,
Okay.
sorry.
All right, thank you. Wendy?
Yeah, and I don't want to beat a dead horse, but Mike, your concern is that people could be alarmed and you question the methodology of this study. And you're assuming that there's something wrong with the methodology, but what if the methodology is solid? I mean, don't we have a moral obligation to inform the public? So, and I don't understand why you question the methodology. There's obviously something going on. I'm not aware of that, but you know, even if we're scaring the public, as you say, and we don't say it's scaring, we say it's informing the public, but don't we have a moral obligation to do that?
Yeah, I'm only raising this because I think there are folks who already have concerns about the methodology of this study. I'm not qualified to determine whether they're valid or not. And that's for others to decide. I just, you know, my concerns, Lorraine was stating, I think very unequivocally, that this is clearly the right study. It's found out what the problem is. And I don't know that everybody who's looking at this necessarily agrees with that right now. And that was my only reason for raising it.
Okay, I don't want to get too repetitive here, but Whitney, go ahead.
Sure. I just wanted to add into that. For a long time, I was the phone number that people called when they had questions and concerns related to this. And I can tell you the flip side is that there is worry and there is concern, and people would call me and say, I'm looking at buying a house here. What can you tell me? I live here. What can you tell me? And I think the other important thing that people would say is like, I don't know how to read an academic journal. I'm not trained to understand this. Like, can you help me to understand what this means? And I would add, like, it is a very standard part of, like, you know, many different academic, you know, curriculums to do critical appraisal of journal articles, because there's all kinds of articles that get printed. I can't speak to the one that you guys are talking about because I haven't had an opportunity to read it, but I think to the question, I think it also depends on who you are, the question of, is it your moral obligation to promote that? And so I think I just wanted to offer that counter of like, yes, there are people that want information, they are concerned, and they do reach out to the health department to get that information. And that, again, I don't think, again, I don't know the methodology. I heard earlier conversation about that we have the data and talking about exposure. And I know there's always that difference between exposure and that there was contamination found, right? The difference is, did somebody actually consume the water? And I wanted to bring that full circle to Rosemarie's question about the birth registry. I was going to provide additional information, which is that you may have different sets of data, right? Like you may have like water testing data from an area, and you may have birth, you know, data. Some of the really costly, complicated stuff is connecting those pieces. And then also even like, again, we may have contamination data and health data, but we may not have exposure data. And so I don't think, I can't fathom that that article had all those pieces to be able to say exposure equals health outcome. My guess is that they probably could find contamination and health outcomes, but there's that other piece. So I just want to, it is really nuanced, and you want to be careful. So I think it'd be great to invite the authors to the next meeting and kind of be able to ask those questions. Thank you.
Rosemarie, last word on this.
Oh, okay. No, I just wanted to kind of address the issue Mike brought up. I don't want to, you know, comment on the validity of the research that they did. I haven't really examined it, and it's been a long time since I've been, you know, out of that type of research field. But I think gathering the data is important, mainly because I kind of compare it to lead. you know, we've had issues in Merrimack and throughout the state with lead in water. In MVD, it's non-detect, but we've discovered that there was lead being introduced into some of the school faucets through the fittings, the water fittings. And, you know, do we know if kids consume that? Do they know if they did, it's leading to issues they have with cognitive ability? But I think collecting that data, seeing if we can go back and get it, and just see if it may not be a causation, but a correlation. Because one of the things that we do see in Merrimack, and especially it's coming to a head now as we're in school budget season, is increase in special ed costs. And I'd be interested to see, was there a correlation between the number of students who are experiencing some type of learning disability and their birth weight, what their birth weight was? And was that during a time when the tap, you know, were they in public water? Was that water having high PFAS at the time? So I know in Merrimack we do have, I see with some people there's a lot of PFAS fatigue, but I'm a really big supporter of collecting data. And even if we don't know how to use the data now or what it means, it may prove to be very important in the future.
You know, Chris, I have one brief last thought. This is the last one. The literature is really rich on this topic in terms of findings, right? In terms of, you know, when we look at PFAS impacts, PFOA in particular, and PFOS, the most studied, we look at low birth rate, premature births, miscarries, infant mortality, impacts on neurodevelopmental, impacts on mom, preeclampsia, preeclampsia during labor that comes up. All these different things have been floating around the literature for more than 20 years. So I would just have people think about this. We are an exposed community. If this is in the literature everywhere on PFAS, why should we be so surprised to find it here? Of course it's here. That's a scary thing for me to say. All week I've been sitting with this. I don't even like saying that aloud. And I don't say the causality and things like that to the public. I mostly listen and give resources and, you know, whatever links I can. Why wouldn't we find it here? I think what's unique about this community, and it's just my personal opinion for all it's worth, that some of the funding we've looked for through the years partnering with various Boston academics on studies, that it's been denied, not on scientific merit. The scientific merit was superb. It was the dream teams. Is if this community in this area would be studied, do you know what it would show the nation and the world? It would show that these chemicals are harmful at much lower levels than ever acknowledged, and that the attention goes more to the high exposure communities, so we can kind of comfort everybody and say it's not so bad and protect liability. But why wouldn't we find it here? What we see in the literature, we see here, and why wouldn't we find it here? That's just my final thought I want to leave people with.
Probably skipping ahead a little bit, but do we know about any pending health legislation that is PFAS centric, like funding phase 4 or? Okay, Rosemary?
All I can say is, and I'm speaking, I don't think Maureen's still on the call, but being on House Finance, anything that would, you know, require, you know, substantial spending is, this isn't a good year to submit it. I mean, departments, including DHHS, took a really big hit with budget cuts. And so I don't, and UNH, I mean, it was really breathtaking to see some of the cuts that had to be made. But anything that would come forward would have to be in the beginning of the next term. So it would be introduced in a year. So keep that in mind. But I don't know of anything that's been submitted, Chris, but if there is something, it's probably going to be dead on arrival before it even gets to the full floor.
Okay. And I guess my other rhetorical question, I don't recall when there stopped being health subcommittee meetings. It was before my chairmanship, but if there is an appetite to do that again, I would encourage people to think about it. And maybe next meeting, act on that. So
Yeah, I definitely think there wasn't any when I was chair either. I think it was just when Senator Deach was the chair. But I think it would be worthwhile to have the environmental subcommittee and health subcommittee meet, just to talk about proposed legislation for the next term, so that that gets fully vetted and understood, and they can really look at what's been going on throughout the state, things going on in the federal government that we may want to tackle here in New Hampshire for, the particular application of this area and this type of contamination.
Does this also speak to, Laureen, the email that you had sent to the commission too, about kind of forming more of an strategic approach to addressing the tasks of the commission?
Yes.
I think having a strategy would be helpful. And in the context of hearing from University of Arizona and also knowing that we have partners at Dartmouth, maybe we can work together with them in the subcommittee to find out what is it that we need to do for next steps? What's the gap in the knowledge that needs to be filled?
okay. Thank you all. I want to move on to.
Nancy had a question, sorry.
Didn't see you. Oh, Nancy, you're down there.
That's okay. No worries, Chris. Thank you. I just wanted to say, I don't know whether I'll be reelected, but if I am, I had already, said within our community here, following up on I filed that HB 614, which was for the kidney cancer feasibility study, and I certainly intend to follow up on that. But to Rosemary's point, much is going to depend upon what happens in the next legislative session, because we certainly need to be adequately funding DHHS and DES. But that, and to Amy's point, I totally agree. We need to strategically look where we invest our efforts and a real plan as to how going forward, backed by the commission. So when things go to the legislature, they recognize, these are not one-offs by a legislator on a pet project or something. These are well thought out policies, needs to address, significant public health issues in the state. So we'll see what happens next session. But right, I mean, we're short. We've underfunded the agencies that we need to be able to do things, and that certainly impacts staffing and a lot of things that we need. So we'll see. Fingers crossed for next time.
Chris, what is the procedure for starting a subcommittee? Is there one, or do we just talk about it in the January meeting about scheduling something? How does that work?
That wheel was invented so long ago. I think that people should think about what their other commitments are, if they have the time to do it, when they would meet, how they would meet, how meetings would be run, and then if who's interested in going forward could form a subcommittee. You would have to have meetings and notes of those meetings, decide how frequently you can, certainly, as Rosemary says, you would want September to be something of a finishing point, because sitting legislators would be submitting LSRs. Wendy?
So yes, and I know that we're going on a long time with this, but way back in the day when I first joined this, not only did we have a environment and health subcommittee, but we had a communications subcommittee, and it might be time to revitalize that and to get information out to the public about what's happening, about what the state is doing, about what this commission is doing, what we're finding. That could be helpful as well.
And I don't want to, kind of be the buzzkill here, but just a reminder that any subcommittees have to be publicly noticed.
Okay. So I wanted to talk about biosolids and wastewater and where we're going with that and what our timelines are. And maybe not in a dialogue with Mike as much as anything. But we have the system on St. Gobain's site that we can talk about and provide some information about, and then just what the timeline is for developing biosolids and where we are in that regulation process.
I'm sorry, Chris, are you asking me a question?
I am asking you a question, yes. Can you fill us in on the commission in on the St. Gobain on-site treatment system? And,
Okay.
in the same discussion, decommissioning of what was there, pipes that were there. And
Yeah, we'd had some communication about that prior to this meeting, and basically, if I understood your question, it was that, you know, for those who don't know, after the discovery of this problem in 2016, among many other things that they were asked to do, St. Gobain was looking at their ongoing manufacturing operations, recognizing that there was a contribution to the Merrimack's, because they're connected to the Merrimack sewer system. There was a contribution of PFAS to the municipal wastewater going into the Merrimack wastewater treatment plant. And there was a desire and an effort to reduce that as much as possible. So they designed and installed around 2018-19, a pretty detailed wastewater treatment system for their manufacturing wastewaters that treated and removed PFAS from those wastewaters, so that the treated effluent coming out of the St. Gobain facility that was discharged to the Merrimack sewer was you know, substantially reduced or you know, essentially remove the PFAS from that wastewater. And the concern was because that, you know, the Merrimack, most of you know that are familiar with Merrimack, their plant treats wastewater and then does treatment and composting of the wastewater sludge at the Merrimack plant. And then that's been for years been used as a soil amendment and marketed far and wide, and also very locally. So there's a real important desire to get the amount of PFAS coming into that plant minimized as much as possible, so that those, also the quality of that, those biosolids that would be distributed for use would be better. And so Chris had asked me about also, I think, whether the sludges or residues that were generated by that wastewater treatment inside the St. Gobain plant, how those were handled. And best information I have is that whatever residues they generated that contained PFAS were handled by a third-party vendor for disposal, not for land application. So there's no reason that I have to believe that any of the residues that were generated in their in-plant wastewater treatment system at the St. Gobain manufacturing facility would have been provided for uses for land application. So does that address the question that you had posed, Chris?
And Nancy, did you raise your hand?
Yes, I just had a question for Mike. Mike, did St. Gobain have to, was there some like requirement that they had to provide DES to document that?
Well, they got actually their wastewater treatment system that was designed and installed in the plant was thoroughly vetted by both the state water division and the local staff in the Merrimack town wastewater plant. So that they actually got an industrial discharge permit amendment and an approval of that treatment process to ensure that it met the requirements. And then there was, and my understanding is that the local and Merrimack wastewater plant officials did follow-up sampling to make sure that the wastewater coming out of the St. Gobain plant had in fact been significantly reduced in terms of the concentration of PFAS.
Thank you.
Rosemary?
Mike, was that based on GAC?
I think it was a combination. I think that was part of it, but I think there were other, I'll be honest with you, I'm not personally familiar with what treatment technologies were implemented, but I think it was a treatment train that included activated carbon, yes.
Okay.
Yeah, Wendy, go ahead.
Somewhat related to this discussion, I'm working with Just Zero and some people from Maine about putting a bill in to put a 5-year moratorium on sludge on agricultural land only right now. We're not talking about private land. It should include private land, but we're just going after agricultural right now. And it would also set up a fund for farmers who are impacted so that they could get low interest loans or grants immediately if they find out that they're contaminated and they have to filter their water, for their crops or their herd overnight. They're going to need to come up with a lot of money. So, we're working on that, and I've spoken to the fellow in Merrimack with the wastewater, and he says that they don't sell to agricultural land right now. That's what he said. But it is concerning that some of this sludge is going to private homes. That's one of the problems. But just somewhat related to this conversation.
Yeah, I just want to clarify that it isn't, the Merrimack takes the sludge and composts it. So it's the compost that's said. But I mean, PFAS continues through that whole chain, but there are things that are removed in the compost process from the sludge.
Okay.
The
And
PFAS presence has been in that compost, and I grabbed some and tested
It is.
it.
I don't want to be nitpick, but
Yeah.
it
I have
composts.
some data, if anybody cares. I have some data that was quite a while after they filtered, and supposedly it would have been all cleaned up like 2.5 years, maybe 3 years. I don't remember how long it was. It was and then I grabbed some and had it all analyzed, and it was still there. I don't know what it was at the peak of the heyday, but it was still a little bit problematic in my mind, and I'm not going to go around bad mouthing our town. So I didn't really do much with that. I mentioned it to some state people, and what do you do with that data? So it's a problem. It's everywhere.
Rosemary,
Oh, I'm all set.
you're okay? Okay, Mindy?
Yeah, so Mike, can you say again, I might have missed it. When was that wastewater treatment closed loop system installed?
I believe it was installed and operational in around 2019. And then there was I remember seeing an amendment, because I think it was it may have just been a typographical fix. I'm not really, there might have been one thing that was changed. And so there was an amendment. The original permit, I think, was issued in 2019. And then there was an amended permit, I think, issued in early 2020. So it would have been around that time that sometime in 2019, I think, that the system came online.
And I remember that prior to that time, though, the sludge that was separated from the wastewater was also deposited in spreading operations. Is that true? And
Are you talking about the Merrimack wastewater plant or the facility?
Yes.
Yeah.
Well, what do you mean? So what's the distinction you're trying to make there?
Well,
what I'm asking
so
is,
there's the St. Gobain plant, the manufacturing plant, and they installed in that plant
right,
a wastewater system that was permitted for pretreatment of their effluent that they discharged to sewer, and that came online around 2019. And I just want to make sure you weren't suggesting that material was provided for land application, because I'm not aware of that. But certainly for many years, as I understand it, the sludge generated at the town of Merrimack wastewater treatment plant has been composted in a facility on that site. And then the compost product has been provided pretty far and wide for agricultural and residential application as a soil amendment. I'm not an expert on what the history of that is, but certainly there are records in our residuals program. I'm sure they would have relatively decent records about whatever we know about it would be available. And then I would presume the town of Merrimack knows exactly what they've done with it, because it's their material.
yeah, because I was under the impression that not only was it sent off for compost for agricultural use or whatever, but it was also used in sludge spreading operations, you know, like along the banks of the Merrimack. And I thought I recalled something about that in the history.
You mean
No.
the untreated sludge that wasn't
Yes.
composted?
Prior to the
That may
waste.
well be. I don't personally know the answer to that, but we would probably have records, you know, to the extent that those activities are regulated by DES's residuals program in the water division, we would have information about that, but I don't personally know the answer to that.
Okay. Yeah, because my concern is that those, and you know, this has been a longstanding concern, not just for Merrimack, but wherever those spreading, you know, whatever you want to call them, I can't remember what you call them, but you know, the operations where they're spreading this waste sludge places is certainly a source of contamination and likely to surface water bodies as well. So I had heard a bunch of people tell me that they were spread along the banks. Some places were close to the Merrimack River banks. In the Merrimack area, but I'm not sure if that's true. And so I'm concerned about the continuing potential source of anything that had something coming from Merrimack, from St. Gobain prior to 2019 would be pretty high in PFAS contamination.
Yeah, for many years, the statewide, there's been a land application program for certain classes of biosolids and sludges. And yes, they have been deposited on farmlands. Again, I don't know specifically how widespread that was for the town of Merrimack, but that's something that's happened throughout New England, and certainly has happened in New Hampshire with a number of communities sludge.
So I wonder if that would be a potential future meeting topic of conversation, if somebody from that program could speak to that.
Yeah, I think we could provide that. Certainly, when Andy, he's no longer with us, but when Anthony Druin was working that program, he worked long hours getting a lot of data about the quality of the sludge that was being land applied, and we've looked at a number of land application sites for impacts. So that's something that, yeah, I'm sure they could, if that's the will of the commission, that's something that we could provide some information on.
Certainly as it relates to St. Gobain prior to 2019.
And, you know, we had met with the biosolids group, or had them come in last year or earlier this year for a presentation. And I may be not remembering correctly, but it sounded like there was some data gathering as groundwork for regulation. Is that accurate, Mike?
Yes, that's correct.
And where are we on the timeline for that, if you know?
Sure. Well, some of the work that was done to establish the soil remediation standards was in tandem with work that was being done to look at potential, you know, the idea of establishing some kind of land application standard for biosolids. And that's still in process. I'm not exactly sure where it is, but that's something that our wastewater division could certainly speak to at a future meeting if that's desired.
Okay. All right. Appreciate it, Mike. Anything else on biosolids? If not, we'll move on. Surface water regulation was another area. You know, thanks to some legislation that Mindy worked on and DES, things got very far along, and by 2020. And so I have circulated the report that was generated. You know, in the executive summary, it shows a number of different options that could be pursued for standards, and different states have used different areas of concern, whether it's health of aquatic life, whether it's drinking water standard, recreational standard, or so forth. But I do think it's time to move forward and make a recommendation on what an appropriate direction is for the state. There's obviously a cost to that that's outlined in the executive summary and in the body of the report, not inflation adjusted. So I would like the commission to start looking at that. And maybe that is an environmental subcommittee topic to prioritize things, but I did want to introduce it, get people familiar with the report. That a great deal of work has been done, and it almost comes down to a value judgment, what kind of standard that you want to do, and then what are the impacts of that choice, because there certainly are impacts of that choice. Mike?
Yeah, so Chris, anticipating that and seeing your email on that, I did ask staff from our wastewater or from our water division to perhaps come and say a few words or answer a few questions about that. And magically he pops up. There's Ken Edwardson. If it's helpful, then certainly Ken could perhaps, or Ted, Ted's in the dark apparently, but he's on here as well. So if Ted or Ken perhaps could maybe just give an update, if it would be helpful on where we're at with respect to surface water standards.
Thank you. Go ahead.
Well, I'll get us started. Hi, everybody. I'm Ted Deers. I'm the Assistant Director for the Water Division, and I've been looking at these issues along with Ken for a very long time. And I've met many of you. You know, some I see that looks like Representative Thomas left. I talked to her 2 nights ago, actually. So, but anyway, I just wanted to note that
I'm still here. I'm still here, Ted.
She's still there. Hi, it's good to see you again. Anyway, we've been working on surface water standards. Ken is our guru on surface water quality standards, and I want to have just a quick update because there are some things that have happened on this front. And it makes sense for you to know where those are, and also kind of what is the normal way in which we adopt surface water quality standards. And that is generally based on guidance that comes to us from EPA. It's called, and I can have Ken kind of talk a little bit about that process. And we have a triennial review that goes on with our water quality standards, in which we're obligated to look at what is coming out from EPA, and they have a number of different things that are in the works related to surface water quality standards. But I'm going to just kind of let Ken give a little update on that report, kind of what we've done since then, and what is sort of in the cooker right now. So, and then we can open it up for conversations. And then if you want to have, if you have a subcommittee, an environment subcommittee or something, and you want to have a meeting at some point where we can dig into these things, we'd absolutely be willing to sit down with you all. So Ken, why don't you kind of give a quick update on sort of the water quality standards approval process and where we are.
So yeah, so unlike many sets of rules, surface water quality standards have two-step process. There's the state approval process. Once it's approved under state rules, it's usable by any state action. And then we take that entire package and submit it to EPA for their approval so that it can be used for any Clean Water Act purposes. And the connection there really becomes the NIPD's wastewater treatment facility and all the other suite of National Pollution Discharge Elimination System permitting that goes on. So subsequent to that report that had been produced over a number of years, we were working on updates to our surface water quality standards. And in February of 2025, we finished the state process for that. One of the things that we did in there is brought in the 4 MCLs, the 4 state MCLs, to be the fish and water ingestion criteria for the 20 miles upstream of any surface water intake. And I'm pretty sure that layer has been added to the PFAS mapper so you can see where those things lie in the world. And then the package was submitted to EPA in April of 2018. And we know with the federal government and how much time they've been furloughed and whatnot since then. But I do understand a partial approval is in the works. And if you had asked me a year ago if this how it would go, I would not have guessed it. But it's possible they may actually approve those 4 MCLs into our surface water quality standards. And the reason that I was skeptical that they were going to approve them is because they had produced their own MCLs, but now they've been like rescinded. And they were working on what Ted referenced, the 304A guidance values for human health. But that work after they drafted their materials has come to a complete and utter halt. So I think they're actually going to approve those PFAS MCLs that we brought into the surface water quality standards, maybe even kind of soon. There's other parts of the surface water quality standards regarding aluminum and selenium that are awaiting Endangered Species Act consultation work. EPA has finalized aquatic life criteria. So the surface water quality standards, people often ask me like, what's the number? And there is no single number. It depends on which designated use you're trying to protect. Are you trying to protect human health? Or are you trying to protect aquatic life? So there are chronic and acute values that have been produced for PFOS and PFOA to protect aquatic life, as that chronic is a 4-day average, acute is a 1-hour average. Those values are really high, some of them. For PFOA, the chronic is, I'll stay in nanograms per liter because we tend to see numbers that are nanograms per liter, but for chronic, it's 100,000 nanograms per liter. For acute, it's 7 million nanograms per liter. When you go to PFOS, the acute is 550,000 and the chronic is 250. When you get to the 250, you start to get to a neighborhood where there might be a spot or two in New Hampshire that we see that are surface waters. So in the coming year, we could move forward and work with our water quality standards information exchange, which is usually how we keep everyone abreast of what we're doing and working on with these. Hopefully we get that partial approval from EPA, that we have something stable to be working from. They also produced benchmark values. So a standard aquatic life criteria is based on 9 families of species with highly detailed information. And when they don't have enough to make a guidance value that we're supposed to consider, they make benchmark values. And those are all in the hundreds of thousands to multiple millions of nanograms per liter. And there's 8 of those that they produced. And then there's I mentioned that they had draft 304A guidance that is now stalled for human health purposes, and those are very, 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 very low. But I don't know where those stand at this point in time.
Wendy, go ahead.
Thank you. I have 2 questions. First of all, how does this work mesh with the EPA decimating regulations and standards for PFAS across the nation? Is there any bumping between the 2 efforts here?
I wasn't sure one thing you said, that EPA is decimating? Oh, like.
Decimating the PFAS standards and regulations across the country to make it easier for businesses. They're threatening to. So is this work independent of the EPA? Is it bumping up against the EPA? Who's the top dog in this?
I guess in the context of, we brought in the state MCLs, so
Yeah.
we're kind of in the driver's seat. Although if they approve them, then they also have to defend them as needed once they've made that approval. In terms of the decimating, things like the stalling of their continued development of new 304A guidance, I think probably fits in that category.
Mm-hmm.
Because these are, highly complex studies, and the report from 2019/2020 there kind of spelled out the dollars and cents behind some of, particularly the aquatic life studies that need to be done. They are, I venture to say, they're well beyond our regular capacity to do any of these kind of studies.
All right, and my second question was, what is the status of treating all of these chemicals as a class instead of individually? Is there any movement on the state level? Is that something the legislature has to do, or is that something that the departments do?
I mean, in context of surface water quality standards, I haven't heard of many people trying to bring that in. I took a quick look earlier today. I was, guessing one question might be like, well, what are other states doing? What do they have on the books?
Well, what are other states doing, and what do they have
So-
on the book?
Perfect, thank you. EPA posts out onto their website a summary of all the state surface water quality standards. It looks like they update it about once a month. So as of November 25th of this year, there were only 2 places where there were EPA approved surface water quality standards for PFAS compounds. One of them was Puerto Rico has adopted the 4 nanograms per liter for 2 compounds for human health, and the other one was a tribe out in Region 5 that adopted 10 nanograms per liter for human health for 2 parameters. If you search out the web, you'll probably see some other things. Like I know New York provided guidance values. They're kind of like they're non-enforceable values that are kind of for aquatic life, and they're in line with what EPA had provided for their aquatic life thresholds, but they haven't actually pushed those through the surface water quality standards process yet.
Okay.
The other thing I would note is that if you look at our water quality standards are located in an ENVWQ 1700. So if you're ever looking for where do you find surface water quality standards, that is where you find them. And there's a long table, what I like to call our table of methyl ethyl death. It has all of the compounds, constituents that we regulate as surface water quality standards. Typically, they are individual compounds. There are a few that I think group, but not very many. Most of them have criteria as individual compounds. And so that would be typical of the way that water quality standards are promulgated.
Right, anything else on this subject? If not, Ted and Ken, appreciate your input, so thank you very much.
Absolutely, and let us know if there's any other future meetings or things that you'd like for us to attend to to have these conversations. Happy to do so. And
I recognize a couple of the names here, so I think some folks here get emails from me when I have WICSI water quality standard information exchange group meetings. I think some of the names here are on that list, so they'll get notices as we move forward.
Perfect. Okay, thank you very much, gentlemen. And next, Maureen's not here, but if we have legislators present with bills pending, I know they probably haven't moved along very much, but if they've gotten bill numbers at this point, you can let us know. Wendy?
I don't know the bill number, but just 2 updates on mine. So the first one is to include condoms and lubricants with intentionally added PFAS to the consumer ban. And that's being spun as Wendy Thomas wants to ban condoms in New Hampshire. I do not want to ban condoms in New Hampshire. I want to ban condoms that contain high levels of PFAS or any level of PFAS, along with lubricants. So there are safe items to use. So I just want to make sure that people understand that. The second, and I talked about it earlier, the sludge bill. I just wanted to let you know one good piece of information is that I actually missed the deadline to sign that off. I was between 2 conferences and just it slipped my mind, and so I had to go before OLS, who sent me to the director of OLS, who sent me to the speaker, who overrode the deadline. So that bill is going forward. So that's one piece of good information.
Nancy, do your bills have numbers, or did your bill have a number?
Yes, I mean, I'm just looking it up actually. HB 1389 is the PFAS facility liability bill that I filed in, I think it was 2024. We passed it in the House and the Senate. Governor Sununu vetoed it. We overturned the veto in the House, but not the Senate, so it did not go forward. And I've refiled it again. So hopefully we'll have better luck this time.
Okay. All right, and then in new business, I will just note that there was a preliminary round of groundwater trust fund distributions. You know, some of you had some interest, and I circulated a little bit of information on that. I don't know if there are any questions or comments to be made. Seeing none. We begin a new calendar of meetings. The second Tuesday of January is the 9th. So we likely would continue at 2 p.m. on Fridays on the second Friday. So unless that gets changed, it would be on the 9th of 2026 at 2 p.m. And that brings us to election of chair. My 2025 term is up. So go ahead, Nancy.
I would be grateful and would like to nominate you if you would still consider being the chair. Chris, I think you've done a great job. And I would love it if you could continue going forward. Please. Everybody turn your mics on and say please.
I will do that. I'm not sure that I can promise anything beyond 2026, but I'm in for 20.
I would second that.
Are there any other nominations? All those in favor say aye. I'll include myself.
Aye.
Any opposed? Any abstentions? Okay, thank you all. I appreciate it very much.
Thank you.
That, I think, brings us to a close unless anybody else has other new business. Rosemary?
Well, I just want to wish Representative Murphy a happy birthday today.
Oh, happy birthday.
Great way to spend your birthday, Nancy.
Yes.
It is. And I just want you to know, I've been listening to my grandchildren go 6, 7 for about a week. And so, yes, yeah, it's the big 6, 7.
No. Congratulations. Everyone have a happy new year. We'll see you in 2026. Thanks very much.
Thank you.
Thanks. Wow.